Today I'm going to talk about edemas, and the first thing that we need to know about edemas is that it occurs due to two main reasons. The first one is related to Starling forces, and the Starling forces are the forces that allow the process of filtration reabsorption of the fluid that goes between the capillaries and the interstitium. So the Starling forces are related to the capillaries, the osmotic pressure inside the capillaries and the interstitium, and the normal pressure of the fluid inside the capillary and the pressure inside the interstitium. So any disturbance in one of these factors would lead to a general disturbance in the Starling forces, which can lead to the edema. The second factor is the renal function. So the renal function works on the retention of water and the reabsorption of sodium. In such a case, this would also lead to the edema. So we conclude from that the edema is the accumulation of the fluid inside the interstitium. Normally there will be an exchange between the capillary and the interstitium, but in case of the edema we would have an abnormal accumulation of the fluid inside the interstitium, which would lead to this kind of a swollen appearance. So what are the types of edema that we have? We can classify the types of edema into two main categories. One of them is called non-pitting, and the other one is called pitting. The non-pitting edema has another name, which is called lymphedema, and from this name we can see that it's related to lymph. For example, after breast cancer, mastectomy occurs or is done, and throughout the process we have in this area axillary lymph nodes. So through the removal of these nodes we would have an edema throughout the arm. So this would be the place where the edema occurs, because the lymph throughout the arm is not drained properly, because the lymph nodes, the primary lymph nodes which were responsible for this job, are removed through the mastectomy. So this would be called a lymph edema. This is one kind of edemas. The other one is called pitting, and this is the casual or the normal form of the edema. And we have an example for this. If we have a case of cirrhosis, so this is the liver, and here we have the portal vein, and we'll see that the portal vein is going through the liver, carrying all the nutritive substances from the abdominal organs and going through the liver in order to allow the liver to extract the nutritive substances and to make proteins like albumin, fibrinogen, and so on. So in case of cirrhosis, this function is not done properly, and the blood will accumulate in the vein, and the vein will be swollen. It will be filled of blood because the blood cannot diffuse through the hepatic cells because of cirrhosis, the scarring that happens in the liver, and we get the portal hypertension. The portal hypertension. And accordingly, with no enough albumin produced, this would actually also affect the kidney functions, and we would have an edema that imposes the factors that we mentioned in the beginning of the video. Startling forces will be disrupted. They will be the balance of these forces will not be the same, and the kidney function, the renal filtration function will not be working efficiently. And for this, I would like to talk about this part specifically because here we have two types of syndromes. We have the nephrotic syndrome with an O and the nephrotic syndrome with an I. And in both syndromes we have edemas happening, but the primary and the secondary causes are different. For the nephrotic syndrome, we have a high loss of proteins, especially albumin. And the liver, synthesizing albumin, will not be able to compensate this high loss of the protein. And in this case, this factor would be the primary event. It would be a primary event, a very important event in this cascade of events leading to the edema. On the other hand, in the nephrotic syndrome, we have a high loss of blood. And in this case, that would be a primary event because this would directly affect the startling forces, which is the first factor that we talked about, which leads to the causing of the edema. And then in the renal function, we would have an effect which is a decrease in the glomerular filtration rate and an increase in the resorption of sodium. Both of these factors, of course, would affect the edema. So a decrease in the glomerular filtration rate will lead to the retention of water inside the vessels and an increase in the sodium reabsorption. So this is the difference between the nephrotic and the nephritic syndrome in the kidney. So that was a brief idea about what edemas are, what causes them, what kind of classification they have. And so next time we are going to talk about pulmonary edemas. I hope the lesson for today was easy, and until the next time, I thank you for watching and see you.